meet a young woman whose diagnosis changed her life. Take a look at this.
I started experiencing symptoms in my childhood. I always had headaches. I always felt nauseous, but when I was in nursing school, that's when my symptoms really came on. I had trouble cutting food, blow drying my hair, brushing my hair. And I noticed I started to slur my words and just having a difficult time speaking. My hands were always tremoring and shaking. It was hard for me to even keep up with nursing school. When I went to see a doctor for my symptoms, it seemed that there was always an excuse, either stress, anxiety from nursing school. The blood panel that my primary ordered did test my hepatic function, but my hepatic function was normal. I never had any further testing or workup on my symptoms.
Wilson disease can affect the liver in 3 distinct ways. Those that have a slowly progressive form of liver disease, they will have usually no symptoms at a time when they have just an elevation of liver enzymes in the blood tests. As the disease progresses, they may develop then yellow discoloration of the eyes or skin. They may develop swelling of the abdomen with fluid. They may present with abrupt bleeding from the upper intestinal tract. A patient who has acute liver failure due to Wilson disease, that is a medical emergency that requires urgent liver transplantation to survive.
Wilson disease can present with a wide variety of signs and symptoms, from abnormal movements such as tremors, personality changes and behavior problems like depression and anxiety. There can be problems with day-to-day tasks due to trouble with fine motor coordination, problems with speech and swallowing, abnormal drooling. There can be balance and walking problems. So one of the places that copper can build up is in a layer of the eye near the cornea called a Kaiser-Fleischer ring. It's a yellowish golden pigmentation that can be seen using a special test called a slit lamp exam that an ophthalmologist can perform.
When I first heard about Wilson disease, I was in nursing school. My professor mentioned the hepatic effects of Wilson disease and didn't go into the neurological symptoms. And she also said you would most likely never meet anyone in your career with this disease because it's so rare. I was driving past the optometrist office one day. I didn't have an appointment, but I decided to stop in there and just get a new pair of glasses. The optometrist noticed copper deposits in my eye, and he did a slit lamp exam and saw Kaiser-Fleischer rings and asked if I had Wilson disease.